Home health clinicians work in environments that are unpredictable, uncontrolled, and often completely unfamiliar. Unlike hospitals or facilities, we step into patients' homes alone, without security and without knowing exactly what we may encounter. That's why clinician safety must be intentional, proactive, and ongoing. In this training, we'll cover clinician safety before the visit, during the visit, and after the visit, including visit planning, environmental awareness, patient-specific risk factors, cultural considerations, de-escalation strategies, and documentation. This guidance applies to all field staff and supports both clinician well-being and agency compliance. Let's dive in. Clinician safety is not just a personal concern, it's an operational, legal, and regulatory responsibility. Unsafe visits can result in staff injuries, workers' compensation claims, missed visits, delayed care, survey citations, and liability exposure for the agency. Every agency has a responsibility to support a safe working environment, and every clinician has the right to pause or refuse care when safety is compromised. Safety begins in the medical record. Before any visit, clinicians must review the patient's chart for known or potential risks. This includes a history of aggression or violence, substance abuse concerns, mental health diagnoses, unsafe household conditions, the presence of animals, or prior safety incidents documented by staff. Supervisors may request additional documentation when concerning information is identified. If a safety concern is identified in the medical records, the clinician should notify their supervisor before the visit, not after an incident occurs. Before the visit, clinicians should confirm patient availability and identify who will be present in the home. Provide a visit window rather than an exact arrival time, and ensure the office is aware of your schedule, approximate arrival times, and expected visit completion. This allows the agency to respond quickly if support is needed. During the same pre-visit call, when introducing yourself and scheduling the visit, clinicians should also perform a brief safety screening. Ask whether there are any known hazards in the home that could affect the visit, such as pets, cluttered walkways, uneven flooring, or other environmental concerns. Identifying potential hazards in advance allows clinicians to plan appropriately and reduces unexpected safety risks upon arrival. Before heading out, clinicians should familiarize themselves with the area they'll be visiting. Home health services occur across diverse neighborhoods and community settings, each with unique environmental and safety considerations. Understanding where you're going helps you anticipate potential challenges and adjust your safety approach accordingly. Before seeing a patient for the first time, ask fellow clinicians if they've visited the patient previously. They may be able to share helpful information about the home environment or safety considerations. Managers also often receive information from referral sources about a patient's living situation. Checking in with leadership helps clinicians prepare appropriately and reduce unexpected risks. Whenever possible, clinicians should plan visits during peak daylight hours. Daylight improves visibility, reduces environmental risks, and enhances overall situational awareness. Late evening or nighttime visits increase safety risks, especially in unfamiliar neighborhoods, poorly lit areas, or locations with limited cell service. If a visit must occur later in the day, clinicians should notify the office in advance and confirm that appropriate safety plans are in place. Before leaving, wear visible agency identification, limit valuables, fully charge your phone, and carry only necessary equipment. Park in visible, well-lit areas, and remain aware of your surroundings before exiting your vehicle. Before entering the home, pause and assess your surroundings. Look for loud arguments, suspicious activity, signs of intoxication, or anything that feels unsafe. If something feels off, trust your instincts. You are not required to enter an unsafe environment. If you are unsure about your safety, either before entering or during the visit, pause and communicate. Some agencies require clinicians to call into the office or a designated answering line, a set answering machine, or voicemail system upon arrival at the patient's home for this purpose. During that call, state your name, the patient's name, and the exact address. This creates a timestamp, ensures leadership knows your location, and, when done within earshot, reinforces that someone is aware of where you are. If concerns remain after communicating with the office, the visit should not proceed. Once inside, identify a clear exit and avoid positioning yourself where you could be blocked in. Remain aware of your surroundings throughout the visit and be prepared to leave if conditions change. Infection control is also clinician safety. Perform hand hygiene on entry and exit, use appropriate PPE, and place your nursing bag on a clean barrier. Assess for unsanitary conditions, sharps exposure, mold, smoke, pests, or strong odors. Do not place yourself at risk to complete a visit. Clinicians should never tolerate verbal abuse, sexual harassment, threats, or intimidation. Remain calm and professional, but if behavior escalates, terminate the visit immediately and notify leadership. Safety always outweighs visit completion. Actively evaluate the home for tripping hazards such as cluttered walkways, loose rugs, cords, or uneven flooring. Also assess for faulty electrical outlets, exposed wiring, and inadequate lighting. Evaluate accessibility features like ramps, handrails, staircases, and entryways to ensure safe entry and exit for both the clinician and the patient. Pets can pose safety risks through bites, scratches, allergies, or fear and anxiety. Clinicians should ask that pets be secured prior to providing care. If animals cannot be safely managed, the visit should not proceed. If weapons are present, approach the situation calmly and without judgment. When appropriate, encourage patients or families to secure weapons, such as locking firearms in cabinets and keeping knives or other dangerous items out of reach during visits. Follow your organization's policies regarding weapons in the home. If safety concerns remain, terminate the visit and notify leadership. Clinician safety also includes recognizing patient-specific factors that may affect behavior during a visit. Patients with dementia or other cognitive impairments may experience confusion, agitation, or unpredictable behavior. Use calm tones, simple instructions, patience, and reassurance to reduce escalation. Patients with conditions such as schizophrenia or bipolar disorder may experience hallucinations, delusions, or mood instability that can affect safety during a home visit. Clinicians should maintain clear professional boundaries, communicate calmly, and continuously assess the environment. If psychiatric behaviors or symptom exacerbation are observed, clinicians should follow their agency's policies for caring for patients with behavioral or psychiatric conditions. If the clinician is not trained or experienced in psychiatric skilled nursing care or is unsure whether the situation exceeds their competency, they should pause care as appropriate and consult with the agency case manager or leadership for guidance. The agency can then determine whether a clinician with appropriate behavioral health training should be assigned or whether additional referrals or resources are needed. Patients struggling with substance abuse may display impaired judgment or erratic behavior. Clinicians should recognize warning signs, assess safety, and follow agency protocols when concerns arise. Cultural awareness supports both safety and effective care. Be mindful of communication styles, privacy and modesty preferences, beliefs about health and illness, family decision-making roles, religious practices, traditional or alternative therapies, and potential language barriers. Respecting cultural differences helps build trust and reduces misunderstandings. If tension arises, use de-escalation strategies. Remain calm, speak slowly, use non-threatening body language, and avoid confrontational language. If de-escalation is unsuccessful or safety concerns escalate, terminate the visit and notify leadership immediately. Leave promptly if conditions worsen. Remain alert returning to your vehicle. Lock your vehicle immediately. Report unsafe locations to your supervisor. Document safety concerns objectively and promptly, including environmental hazards, unsafe behaviors, and visits ended due to safety. Complete incident reports according to agency policy. Documentation protects both the clinician and the agency. Clinician safety in the home is not optional, it's essential. When safety is planned before the visit, assessed during the visit, and addressed after the visit, clinicians are protected, patients receive better care, and agencies remain compliant. Thanks so much for watching. If you found this video helpful, give it a thumbs up. It really helps others find it too. Don't forget to subscribe so you don't miss out on more tips and resources. Looking for easy-to-use digital tools for managing home health? Check out my Etsy shop. Link is in the description. If you have questions, ideas, or want to share your experience, leave a comment. I'd love to hear from you. And feel free to share this with anyone who might find it useful. See you in the next video.